The problem with stroke is it's happening right now, and you're faced with this awful situation that happens just out of the blue. You want to make sure you're having the best care. We've been doing this longer than anybody. We're more experienced than anybody. I would say that we are one of the unrecognized jewels of this community.
The doctors that make up our stroke team are not just recognized locally and regionally, but nationally, and in fact are respected worldwide.
So we were the first multidisciplinary stroke team in the country. We were instrumental in developing the first treatment for stroke ever. We designed what was called the Cincinnati Stroke Scale back then, but now is known as the NIH Stroke Scale, which is used worldwide to measure the severity of stroke.
And what sets us apart from not just the regional stroke teams, but also national, is that we lead these clinical trials that bring in first-in-kind therapies to stroke patients. So you're not just getting wonderful clinicians, but you are getting these amazing scientists who are leaders in developing these therapies that you're getting.
They've developed numerous innovations, including approaches to identifying strokes in the pre-hospital setting, and led to clinical trials that allow us to treat patients in the acute stroke setting. And they are the National Coordinating Center for StrokeNet.
The only way we move things forward is with research. So when that patient and their families participate in a research trial, they're paying forward with knowledge about how their kids and their grandkids and their neighbors may get stroke treatment in the future if it happens to them.
The UC Stroke Team is dedicated to the community, dedicated to improving stroke care. That level of dedication and commitment to the community, I think, is pretty rare.
We care about the community, not just those who come to UC Health, but our entire community.
When you come to UC Stroke Team or UC Stroke Team comes to you, you're getting cutting-edge, wonderful clinicians that are good human beings that really care for patients.
That are absolutely the experts in the field, but really love to teach and mentor the next group of physicians. And then that was part of what brought me here initially and kept me here at the University of Cincinnati.
And I would say we're in the top couple in the entire world in terms of stroke teams. So why would you go anyplace else if you have the very best?